I want to talk about kids and the coronavirus. Um, uh, Historically, meaning 6-7 months ago, kids were very few would have anything but very mild common cold symptoms, say for 3 days, and then it was over. Right now, to date, we have some 358,000 plus kids that have tested positive for coronavirus in the United States. 19 have died, which is 0.3%. And all of the ones, and I'm going to say all the ones who died of COVID, who were under the age of 18, had pre-existing conditions. There's a couple of them, like 9 years old and 7 years old. The newspapers said there were no reported pre-existing conditions. Well, if I would have done the autopsy, I guarantee I'd find it. We're talking about Crohn's disease, celiac disease, irritable bowel syndrome, appendicitis, asthma, bronchitis, dry skin. We're talking about things like, any clickety joints and that kind of stuff. It doesn't take much, okay, which gives you a clue that these kids are eating lots of gluten. They're not absorbing nutrients. And not only do they have things like asthma, which is very, very big problem when it comes to absorption of nutrients. So asthma is a deficiency of a single nutrient. It's a big, clumsy nutrient. And so it's one of the first things that kids get when they have damage to their small intestines from the gluten, okay? And then it's one of those things where if we take care of our kids and get rid of their pre-existing conditions like asthma and bronchitis and, again, skin problems, eczema, dermatitis, psoriasis, and rosacea, we get rid of things like bowel problems of all kinds, constipation, diarrhea, diverticulitis, irritable bowel syndrome, Crohn's disease, appendicitis, all that kind of stuff. It doesn't have to be a serious, life-threatening pre-existing condition to cause the problem, okay? When you can't absorb enough nutrition to prevent and reverse asthma, that means you don't have enough nutrition being absorbed to make your bone marrow happy so the bone marrow can make white blood cells to go through the bloodstream and go and kill and eat the viruses, okay? So it's imperative. Even though you think, well, it's a childhood disease, no big deal, it is a big deal, okay?